Wellness Wednesday, and you know what that means. We're bringing you more resources that can improve your quality of life. Dana DiPiazza joins us live now in studio to share some useful information, especially if you struggle with joint pain.
That's exactly right. Now, the goal on Wellness Wednesday is to really help you feel good, but long term. Now, that's exactly why orthopedic surgeon Dr. Chris Palmer is prepping for surgery with a very intelligent assistant. It's one that doesn't have to wear scrubs. It's actually a robot right now helping Dr. Palmer perform less invasive knee and hip replacements. That means incisions that are even smaller and more precise than before, a shorter recovery time, and overall improving the quality of lives all across the Lou.
The ability to move around as you please is something that so many of us hardly give a second thought, and we might even take it for granted. But with chronic hip or knee pain holding you back from doing what you love every single day, it's pretty impossible to overlook.
I like to travel with my kids, my grandkids. I like to be a part of everything, and if you can't walk, you're not a part of it.
The thought of being confined to a wheelchair or a scooter isn't really something that Debbie wanted to do for the rest of her life. And after hearing about Dr. Palmer's shiny new robot assistant, she decided to pay him a visit.
I don't want to feel old. I want to age, but I don't want to feel that way. I want to be part of the group.
A knee replacement and time to recover isn't really a new experience that Debbie's had to pencil in her calendar, but something she says she'd absolutely do again after having such a positive experience with Dr. Palmer's robotic-assisted surgery.
I had my previous knee done, the left knee done, 4 years ago, and it was very difficult, so I was afraid to do it again. And then when the robot assist came up, I thought, let's try that. Let's try it. I'm hearing it's less invasive and less recovery, so I was really anxious to try that. And it was correct. A lot less time for recovery. 1 day in the hospital instead of 4. So everything was totally different than what I'd expected from the first time.
While comparing her first knee replacement to her most recent one with Dr. Palmer, she says the entire experience and recovery process is like night and day.
Post-op, it was probably at least 6 months for the first time before I felt like it belonged to me. The second time, a month, 4 weeks. 4 weeks I was in, it felt fabulous. A lot of walking. I can do a lot of walking now without pain. I don't have to worry about sitting down every 15 minutes. So, huge difference.
One of the biggest concerns is that post-surgery downtime, all of that discomfort, and potentially even some lingering pain. But Debbie says with this robotic-assisted replacement, that's simply not a cause for concern.
I had less swelling, the incision is shorter, and the physical therapy was a lot easier this time.
So, if you're thinking it might be time to schedule that consultation, you're probably right.
Again, it's a quality of life issue. It's not an age issue. It's a quality of life issue. And don't be the one sitting on the sidelines anymore. Don't do it. Why? There's no point. Dr. Palmer does a wonderful job. He's got a great bedside manner. I wouldn't put it off any longer. It's not worth it. Not worth it. Just go ahead and do it.
Debbie even said that those post-op appointments are a breeze. So again, they really take care of you through physical therapy as well. All that info right there on your screen, drpalmerortho.com.